Did you know that you can earn over $100,000 a year working in the healthcare industry without a degree? Stay tuned as we uncover how you can scale into a lucrative career path in the healthcare industry without taking the traditional education route. Welcome back to my channel. Today we're diving deep into high-paying roles in the healthcare industry that do not require a degree. So if you are looking to get into a six-figure career, stay tuned. You don't want to miss this. So let's dig into these high-paying job opportunities. So working in health information management and health information technology, you can actually make more money than a registered nurse. As of the last data that came in, the average salary range for a registered nurse in the United States of America is around $94,000 annually. And for health information management folks, our national average is sitting around about $70,000 annually. But you don't have to settle for the average, and you most definitely don't have to settle for less. In this video, I'm going to tell you guys some of the high-paying positions that do not require a degree. Now, here's my disclaimer, because I see this a lot in social media posts whenever I talk about this. That's not true. That's not true. You need to have a degree. You need to have this. You need to have that in order to make six figures in that kind of role. I've said it once before. I'm going to say it again. Degrees and certifications inside of health information management and health information technology is employer specific. What does that mean? That means company A may want you to have a degree, a certification, and a certain amount of years of experience, and company B may only be worried about the certification that you have and the years of experience that you have. Inside of my post, I always put it inside of the caption, letting people know that while these positions may not necessarily require a degree, the company may require a certification of some sort, and in addition to the certification, a certain amount of years of experience. But with all of that being said, yes, there are positions that you can work in inside of the healthcare industry and make a six-figure income without having a bachelor's degree or a master's degree. Some of them not even an associate's degree. All right, so coming in at number one, we have cancer registrar. This is a position that you can pursue and scale up in your career. Remember, with the HPTs, get into the healthcare industry and strategically make pivots every 1 to 2 years until you get mid-level experience and continue to scale up in your career. This is a position that pays up to $46.86 an hour. Depending on the state and location, it can be even more. But this position that we have here, cancer registrar, is one of the few positions inside of the healthcare industry that you can pursue and make a six-figure income without having a degree. As you can see with this company here, City of Hope. So if cancer registrar is on your list and you don't necessarily want to obtain a lot of student loan debt, then this may be a company that you want to add onto your watch list. This position here, I'm not sure if it's remote. Let me just do a quick search. Oh yeah, it's right there. So this position actually is remote. It's located in California. For those of you who have questions like, okay, so it's remote, but it's in a different state. Do I have to live in that state? You can always apply for the position and call the Human Resources Department and ask someone in the department, is there a state requirement or a certain mile radius requirement in order to apply for the position? But usually if the company doesn't make it like very clear in the job posting that you must reside in the state, they probably do not have a residency requirement. So moving along, as you can see here for this cancer registrar position, they are asking for high school diploma at minimum and post-high school vocational or specialized training. So this may be a course that you've completed that allowed you to get the cancer registry certification that probably took anywhere between 12 to 18 months, depending on the program. It also says 2 years in allied health profession with at least 1 year as a cancer registrar, or completion of the cancer information management program or equivalent, including passing the CTR exam within 1 year of appointment. So let me just highlight this here. If you have 2 years of experience in an allied health profession with at least 1 year as a cancer registrar, right? So let's just say you're someone who, by any chance, had the opportunity to work in this kind of environment, but you're not certified yet and you want to get certified. That would mean that you could potentially qualify for this position here. You can go ahead and apply for it, leverage your UCA, your unique career advantage, your previous work experience, and apply for this position because this is a company that is actually willing to give you 1 year to obtain the certification after they hire you into this position. So as we can see here, there is not any indication of a request for an associate's, for a bachelor's degree, or for a master's degree. They are just simply asking for high school education, post-high school vocational specialized training, 2 years of industry, with at least one of that working in a cancer registry position, and the ability to sit for the exam within 1 year. And even if you were someone, let's say you have the 2 years of experience, but you don't have the 1 year of experience as a cancer registrar, but you worked in, let's say, like an oncology practice or, some sort of department. Let's see, like they have pathology, cytology, radiation oncology, nuke med. So let's say you've worked in one of these departments, but you didn't necessarily work as a cancer registrar. I would still say put your neck out there and apply for this position if you were truly interested in it. Depending on how you write your resume would determine if it's appealing or not for the hiring manager or the recruiter to call you in for an interview. Okay, so again, coming in at 1, cancer registrar. All right, now number 2, the second position that you can pursue inside of the healthcare industry and make a 6-figure income without a degree is a hospital outpatient coder. Okay, got that? Hospital outpatient coder. Now, scrolling down, this is also a remote position for those of you who would be interested in this position, but I'm going to scroll right down to the requirements for this position. They are looking for someone with at least 2 years of continuous hospital coding experience within the last 5 years. They're looking for someone with a high school diploma, also medical terminology, anatomy, physiology, ICD-10, CPT, the basic things when it comes to working in a coding position as far as education is concerned. This is what they're looking for. They are also looking for someone with an RHIT or CPC or CCS or CCA, so also Certified Coding Associate or RHIA. Now, this is something that I want to point out, and let me just go down right here to the salary amount. They're paying up to $51.61 an hour for this position. And let's scroll back up. Now, when you see them say things like or use verbiage like preferred inside of job postings, we got to make sure that we're reading in between the lines and that we are reading to understand. Sometimes people see certifications or degrees listed inside of a job posting and begin to disqualify themselves for the role before applying for the position. Okay, just start self-rejecting. When they say or, this means you can have this or that. It doesn't matter which one of these you have. If you have the RHIT, that's fine. But if not, if you don't have the RHIT, you have the CPC, that's also fine. If you don't have the CPC, but you have the CCS, that's also fine for this position. It's also fine for you to have the CCA. Now, reminder, for the CPC, for the CCS, for the CCA, these certifications do not require a degree. You do not have to have an associate's, a bachelor's, or a master's degree to get the CPC certification, the CCS, or the CCA. So this is an employer that I would consider to be very flexible in terms of educations and certification requirement for the position. So you could pursue this position. Let's say you do have 2 to 5 years of experience and you do not have the degree. You can apply for this position and scale your way up. Right? Will you necessarily come in making 6 figures immediately? No, but that's not what we're focusing on. If you are trying to get in the industry or you're already in the industry, you're starting to scale your way up, Don't focus on what you don't currently have right now in the moment. What you should focus on is your plan of action, knowing exactly where it is that you are trying to get to, and creating a plan of action to implement and execute. And before you know it, 1, 2, 3, 4, 5 years will fly by, and you will be in that bracket of people who qualify for these six-figure roles. All right, going on next to our third one. Number 3, last but not least for this video, is Charge Master Analyst. You may also see this position listed as Charge Description Manager. And this is a position that I've noticed that quite a few people do not know about. They're like, what is a charge master, right? So in the charge master position, this individual is creating the charges in the systems for services that are being provided, mapping it out to different cost centers, making sure that it is aligned with the payer contracts that we have in place, making sure that we don't have like any charges or services that are being charged for departments that would make the facility like out of compliance. This individual, I would say, is someone who is well versed in compliance, also revenue cycle, revenue integrity, also coding. This person is usually someone who is very well rounded, who has been in the industry for quite some time and know their stuff. That is what I will say. It does take quite a bit of experience in different areas to be successful in a charge master role. And nonetheless, what I will say also is that it is something that you can learn, but you would have to have someone who is your teacher, your coach, or your mentor in this position who has a lot of experience if you are like learning on the fly and don't necessarily have all the experience in all those areas that I just mentioned. But in this position here, I'm going to scroll down to the salary. Let's go right here. So they're paying up to $123,000 annually in this position. The requirements, they're looking for someone with 3 years of experience in CDM management, also 3 years of experience in a large healthcare system, 3 years of experience as a certified professional coder, and 3 years of charge master management experience. All right. Now, as far as the education is concerned in this position, they did not mention anything about wanting someone who has an associate's degree, someone who has a bachelor's degree, or someone who has a master's degree. They didn't mention any of that in this position. And as you just heard me mention, in this position, someone who could excel in this position is someone who has a billing background, a coding background, someone who has worked in revenue cycle. Like if you've worked in multiple areas, so 2 or more of those areas, this is a position that you can potentially excel in. You don't necessarily need to have a bachelor's degree or a master's degree to get into a position like this. Now, will there be some companies that want you to have the degree? Yeah, you're going to come across some companies that want you to have a degree in some of these positions that I listed, but that is not always going to be 100% the case. You're going to come across some companies that have no mention about a degree requirement. And I like to tell people to do what's best for you. Pursue the companies that align to what it is that you want to do personally. So if you do have a goal to pursue your education further and get a degree because this is something that you personally want to do, then by all means do that. Right? Do that if this is something that you personally want to do. But if you're someone who was like me and it's like, I don't necessarily want to go into student loan debt. I don't necessarily want to have to spend a lot of years in school, right? I wanted to do something where I can get my degree. I have my degree in health information technology and associates, and I have the registered health information technician credential. I wanted something that would be extremely valuable and profitable at the same time, and that I can get done quickly and begin to work on scaling in my career. I didn't want to do 4 years of school. I didn't want to do $40,000 to $80,000 in student loan debt. So if you have the opportunity to pursue a company that will take the certification over the 4 years of education, so the bachelor's degree, and you're the person who has a certification, then by all means, pursue companies that align with your current level of experience, skill set, educations, and credentials, right? If you had to choose between $60,000 in student loan debt versus spending about a few hours researching the companies that will take the certification, so you got a few hours of sweat equity in there, what would you rather do? $60,000 in student loan debt, or a few hours of sweat equity identifying the companies that align with what you currently have? I'll take option 2, Alex, the sweat equity. Okay, I'll take that over the $60,000 in student loan debt, right? Everyone has different goals that they are trying to chase. So there may be someone looking at this video saying, like, I want my bachelor's degree. I don't care about the student loan debt. This is something that I want to do. Absolutely. Definitely do that. Degrees and certifications do make you more marketable. Inside of the healthcare industry with health information technology and health information management, is it 100% necessary for you to have a degree for some of these positions? No. Just like I have up here on the screen, this charge master analyst position does not require a degree. This hospital outpatient coder position does not require a degree. And this cancer registrar position also does not require a degree. And also certified patient coders. So if you're an inpatient coder as well, inpatient coders get paid very well. What I will say is inpatient coding is a different animal. It's a lot more challenging, but I wanted to show you guys some of the positions that you can pursue if you are trying to scale to a six-figure salary, the positions that you can try to target. So if you do want to become a cancer registrar eventually, and you're not currently working in like an oncology department, what I would recommend is to get your foot in the door, like start pursuing some patient coordinator positions, and then scale your way into a cancer registrar position. So you'll be getting your foot in the door as a patient coordinator or surgical coordinator of some sort inside of this department or this type of healthcare entity, and then work your way over into a cancer registrar position, and then work on getting the certification. If you want to be an outpatient coder, right? If you want to work in medical coding, another position that you can pursue actually is medical billing. You can actually get into medical billing roles without having the certification at all. Medical billing and health information specialists are some positions that you can get into that will expose you to medical coding. And then from there, you can kind of decide if this is the path that you really want to take, and then scale your way up from there into hospital outpatient coding positions and pursue your education and certification in these kind of roles. If you want to become a charge master analyst, what I would recommend for you to do is a few different things, like you heard me mention when I talk about this position. I would recommend getting into a billing position. I would recommend doing some medical coding. I would recommend also getting into a revenue cycle analyst position or a revenue integrity analyst position. And then from there, after you get some experience up under your belt in those different areas, then I would pursue a charge master analyst position. Some of you who are watching this video now may already have that experience. You may have already did some of those things. So you might be on track to pursue some of these positions. It is all about presenting the right version of your resume to the right companies for the right positions at the right time in order to get your foot in the door. Make sure that you are targeting the HPTs, the high paying targets. That is a combination of the companies you are pursuing, the particular departments that you are pursuing, where these companies are located. All of these things matter. What a cancer registrar is getting paid in California would not be the same of what a cancer registrar is getting paid in Florida or in Georgia or in Tennessee. It's going to be totally different. So where you decide to focus your time, effort, and energy with your job search 100% matters. All right, so I hope you guys enjoyed the information that I shared in this video. The positions that I talked about in this video are still active. I'm going to put the link to them below in the description. As a friendly reminder, you guys, I am not affiliated with any of these companies. You have to apply with these companies directly. You cannot send your resume to me for consideration for these roles. If you happen to click on the link and it's no longer active, that means that they have filled the role, and that is highly possible, especially if I share it in my email or in this video here. Hundreds of other people are going to see the video and the link, and once they get a good amount of candidates, they're going to take it down. But I hope that you enjoyed the information that I shared inside of this video. Let me know in the comments if there are any questions that you have or any other videos that you would like for me to create. Also, be sure to check out the description down below for any resources that you may need to help take your career to the next level. Until next time.